Kids and teens grow and change every year. Regular well child checks help keep them healthy and on track. In this video, you will learn about Grace Health's path to prevention at our school-based health centers. We make it easy to get care, find helpful resources, and support your child's health at every age.
Hello, my name is Dr. Elizabeth Meller.
And hi, I am Gina White, LPN.
And we're here to talk about Grace Health and some of the services we offer our community. So just so you know, as a pediatrician, I work with kids on a regular basis, and well child care is a top priority. And one of the great things about well care is that it's not just about shots, though that's a very important part of it. But if you're choosing to not vaccinate, we still want to see kids because it's a great opportunity to talk about how their health is doing, how they're growing, how they're developing, how they're doing at school. And one of the opportunities at Grace Health is we actually have some health clinics in some of the schools in Battle Creek area. And Gina will tell us more about that in just a little bit. The other things I want to really focus on is that at the well visit, you'll talk about kind of what's been happening in the last year since you've been seen, how you've been doing, if you've seen any well child or any specialists, or if you've gone to the ER or urgent care or even our walk-in clinic, which is available most days. And you can always look at our website for updated walk-in times for that service. We also can talk about new problems. But just remember, if that new problem is a pretty significant one, we're likely going to want to just focus on that and keep the well child to be able to talk about the other important things that are happening with your child. We'll also talk about how school is going, and for those kids in that 5 to 21 age group, those are an excellent opportunity if they're struggling to get to our main site for care or are just looking for a different opportunity. They can be seen at our school. School clinics. We do have an opportunity to talk about goals at your visits, and we will also then come up with a plan for both how to keep your child healthy and safe. So I think the other thing that I get most questions about are sports physicals with these well visits. And the thing that we need to remember is that the state of Michigan requires sports physicals to be done after April 15th of the school year prior. And our well visits can incorporate a sports physical, especially if the parent has already filled out the form and if the child has not been seen in 366 days. Different insurances are a little bit different than that, but we try at Grace Health to schedule out a full year to make sure that there are no insurance issues with that. And I think the important things about our school-based clinics are that we have fantastic staff there. We have a medical provider at 4 of our sites with support staff, and behavioral health is at all of the sites that we have medical. And then behavioral health is also at many other schools. Gina is one of the employees there, and I will let her talk more about our school-based clinics.
Yes, so we are open year-round. So even if you are thinking, well, the school-based health center is probably closed, it's summertime. That's not true. We're actually there in the summer. We're there during spring break, the holiday break, so always keep that in mind. It is best to check the Grace Health website or contact the main site at 269-965-8866 for the most updated hours. We do require a consent form for anyone ages 5 to 21 to be seen in the Student Health Center, even if they're not a student at the school that we are based in. For instance, we have medical centers in Lakeview High School, Battle Creek Central, Northwest Academy of Performing Arts, and also Springfield Middle School. So even if your child or your young adolescent or young adult is not based in any of those buildings, they can still receive care. We can see any patient in the state of Michigan, ages 5 through 21. We will need that consent form. If you do have a student that is in one of those buildings, we can arrange The well child visit, as Dr. Mettler just discussed, if there's an acute illness or an injury, immunizations, sport physicals, we can see students for all those things. We can arrange a time during the school hours, or if you would like to be present, we can arrange an appointment time for the parent or guardian to be present. We offer assistance with enrolling in Medicaid if you are in need of health insurance. And if you just wanted to get some information on the school required vaccines, we work with the school closely on each year. They will let us know how many students they have in the building that may need the vaccines, and we can also coordinate a time to do those vaccines and the well child visit if it is that time. We do not require you to be a Grace Health patient in order to use our services. We are open to all ages 5 to 21-year-old patients. Starting April 15th, after April 15th of each year, if you do have a student participating in sports, they will need a new sport physical form. We can do those at the school-based health centers. We can coordinate it with the well child if it's time. If it is not, we can schedule a sport physical form. Again, we will just need a parent present or that consent form completed. And we will be open all summer long to complete those, so you won't have to wait at the last minute kind of scrambling around to find a place to get that physical done. And if you do have a student who is interested in behavioral health services, counseling, just some strategies on how to deal with the day-to-day anxiety and stressors in life, we also have select locations that do ADHD testing and autism testing with a referral. Again, reach out to our main site of Grace Health at 269-965-8866 for more information. Also, using the Grace Health Student Health Center, you have access to our 24-hour triage nurse line. If you have a concern or question after hours, you can call that. And using the Student Health Center can also save trips to the urgent care and ER sometimes. If you have a 5 through 21-year-old who is hurt or needs an x-ray ordered or just an evaluation for an injury, we can handle that at the Student Health Center as well and hopefully save a trip to the urgent care and emergency room.
And just a reminder, if you have any questions or any of the things we talked about today made you think of something, please reach out to Grace Health. Our number again is 269-965-8866, and our website is updated with our most current information. Thank you.